In college, I played football. In my second year, I had an injury to my knee where I had an ACL injury, I had some cartilage injuries too, so I had multiple knee surgeries. Being able to get in quickly and get seen quickly is very important because oftentimes the next question after an injury is, okay, when can I go back? And I'd like to be able to answer that question kind of that week than in 3 weeks from now, because that's a lot of time that's missed. I do enjoy being a medical detective. That is part of my training as an emergency room doctor. Our job is to figure out what's going on, and I think I've taken that and incorporated that into my sports medicine practice as well here. I'm actually part of the emergency sports medicine service here, so our focus is that we always want to make sure that we have availability to get patients in and get them seen and get them evaluated. It just feels like a normal conversation when they come in, and we just kind of talk about what happened, what they're how they're feeling, kind of what their background is, and like what sport they do. What's your practice schedule, what's your game schedule coming up, what events you have coming up, or if I have a middle-aged patient that isn't so much in competitive sports, like, okay, what do you have going on in your life? Like, what big events do you have? And a lot of times, a lot of these injuries don't need a surgery, and a lot of it's just figuring out what the next best steps are, and we kind of help to guide patients and talk about the different options, whether it's rest, whether it's modifying your activity, whether it's physical therapy. Sometimes we recommend seeing one of our surgeons for a surgical consultation, and we have a whole team of people here that we can refer patients to and that we have great connections with. I think the best outcomes come from when there is that team approach and everyone's on the same page. And especially, in the sports medicine world, like being part of a team is what it's all about. And I think the more we can model that from the medical side of things too, the better for our care.